Welcome to your Clinical Orientation Essentials course for O'Grady-Peyton International Clinicians. This is OGP's Clinical New Hire Orientation to introduce you to information that will be necessary for a successful orientation and assignment. The information presented will help you to gradually adapt to nursing practice in the United States. My name is Gillian Williams, and I'm the Clinical Director with O'Grady-Peyton. I'm actually a former OGP nurse who came to the US just like you are doing now. I had to learn many different ways of providing care and the way a different healthcare system operated. You will receive all of the support that you need to assist in your transition to US practice and to the US healthcare system. Upon review of this presentation, you should be able to describe and identify the progression of orientation from start to completion, average orientation lengths, 6 best practice areas of focus during orientation, importance of customer service and implications of negative patient perceptions, challenges you may encounter post-orientation, and resources available. Here is our agenda. We will cover initial expectations, average orientation lengths, best practice, customer service, internal challenges, and resources that are available. Let us review what you can expect when you are about to start your orientation. Prior to the start date or on the start date of your general hospital orientation, you may be required to complete certain activities necessary for starting work. These may begin with reporting to the Human Resources Department and receiving your new ID badge. From the official start date, you will be going through a general hospital orientation with other new nursing staff. You will be involved in educational classes, including online coursework and skills training, including computerized documentation training. Your general classroom orientation will last for several days within the first week of work and may even extend into the second week, depending on the facility in which you are assigned. It is recommended that you ask during this classroom time about the approximate length of your entire orientation so that you are aware of that time that you will have to get sufficient patient care experience before working independently. Week 2, your unit orientation. After the general hospital orientation is completed and you report to your unit to start your clinical orientation, we advise that after meeting your preceptor that you ask for a tour of the unit so that you will become familiar with the unit layout and where different areas are located, like the medication and storage rooms, for example. You should only observe the preceptor on the first day, since you are coming from a different environment and do need to observe the activities that you will be expected to carry out before actually practicing them yourself. In subsequent days, you should start with the minimum number of patients or lower responsibilities, then take gradually increasing patient care responsibility to establish hands-on practice with your preceptor's supervision. Adapting to different practices. As you work your orientation shifts, you will need to seek hands-on experience with practices like physical assessment, medication administration, Using different pieces of equipment like IV and feeding pumps, for example, practicing patient admissions and discharges. Make sure that you have your stethoscope with you from your very first day on the unit to help with your physical assessment. You will need to practice managing care for your patients in addition to documenting quite a lot of information within the time limits required. In the US, the EMR documentation is typically quite extensive. This can be a challenging time as you are learning several new or different processes that are not like what you were accustomed to in your previous experience. For example, here in the ICU or critical care units, the doctors are typically not present 24 hours a day. Typically, doctors see patients and leave to review other patients within the hospital. They are typically not present during night shifts. If they are needed after their main patient visits in the ICU, the nurses must page or call them. Nurses may receive orders over the phone that they may be allowed to enter into the computer and carry out. This is a common difference and one example of a practice that many international nurses will encounter for the first time. As a result, willingness to learn a new or different way of doing things is necessary to carry out care according to the policies of your hospital. Your nurse preceptor relationship. As you orient with your preceptor, establishing a good rapport will help you to learn. Be sure to ask questions about what you are expected to do and remind your preceptor that you are asking about items that are different for you and you want to make sure that you are doing what they expect of you. When you ask questions, consider that the preceptor does not have your background and has never worked in your country. So be mindful of how you ask a question or how you describe what you did before or didn't do. For example, saying, I didn't give this medication before, when what you really mean and should say is, I did not give this medication IV push before, but I did give it PO. This provides more clarity and prevents the preceptor from assuming that you simply did not give this medication at all. When you are completing a new task, it is also helpful to talk it through with your preceptor so that the preceptor understands your rationale and can help teach you as well. Remember, how you ask is as important as what you ask. While you are expected to communicate clearly and openly with your preceptor so that he or she can give you targeted learning experiences, if you ever feel that the relationship is not developing well or you are not receiving the guidance that you need, please inform your manager or unit educator, but also inform your OGP clinical manager so that we can ensure that you get the help that you need. Additionally, if you are having a different preceptor each shift that you work on a patient care floor, this can make it challenging to determine what progress you've made day to day. Many hospitals do allow their new international nurses to orient with multiple preceptors in order to experience different perspectives, which is fine. However, if too many preceptors are impeding your ability to learn, you may ask your educator or manager if the number of preceptors that you have could be reduced. On that note, one cultural difference that you might expect is that unit managers are actually very relaxed in the US, where they encourage frequent communication with their nurses. Managers are addressed typically on a first name basis, and they do have an open door policy where they encourage all staff to come into them for help if needed with patient care questions or staff concerns. As a member of the team, we want you to feel comfortable and well supported, and we encourage you to speak with your managers as needed for on the spot support as well. As your orientation starts winding down and you are taking most or all of the patient care responsibility, with the preceptor simply functioning as a resource if you have occasional questions, be sure to ask for any outstanding experiences that you still need. Make sure your time management is good and efficient, that you are completing all patient care and charting items before it is time for shift change reporting. Make sure your orientation checkoff packet is completed and signed and is handed in by the deadline, and confirm exactly when you will be coming off orientation to function independently. The length of your orientation that you will receive with a preceptor depends on your specialty. While no two hospitals are identical, typically medical, surgical, and telemetry unit nurses receive approximately 4 to 6 weeks of orientation. Critical care, labor and delivery, and emergency department nurses receive approximately 4 to 8 weeks of orientation, and operating room nurses do tend to receive a few extra weeks due to the need to orient through different surgical areas. It is very important for you to focus on becoming accustomed to the EMR documentation and strict time management while orienting. While these two are certainly not your only areas of focus, they are very common areas in which nurses might be unfamiliar. You will have been provided with documentation training at the start of the general orientation, or may have received extra resources from OGP, but at any point, if you need extra help, again, inform your educator or clinical manager definitely for help. Time management is a critical area to focus on during the orientation. It goes hand in hand with EMR documentation, which is one of the more time-consuming tasks that you will be learning. This is why becoming accustomed to the EMR will be important to you completing your work on time during and by the end of your shift. We will talk some more about time management in the following slide. Be sure to review your performance and progression through the orientation with your preceptor, educator, or manager so that you know whether you are on target to come off orientation within the expected time or whether any further work is needed for you to meet the orientation time deadline. You should have these conversations weekly or every 2 weeks at the most. Be proactive and ask for frequent and specific feedback on what you are doing well and what you need to work further on. Ask your preceptor, manager, or educator. You almost cannot ask too often. Here is a handy tip. Make sure that your patient care responsibility is increasing each week so that you are constantly learning and adapting to caring for more patients till you reach the full quota of patients that nurses typically manage on your unit. If you are in the operating room, this means that you must work steadily to learn how to circulate in the different specialties as soon as you can. Particularly for operating room nurses who need more orientation, ask about your case assignment in the evening before your next shift so that you can review what you would need to do to prepare. Practice tips. Let us review some tips that will help to create a great first impression and help you to navigate this new culture and nursing care environment. Excellent communication is the number one secret to success. Remember that communication is comprised of both verbal and nonverbal elements. Here are some questions to think about as you consider your own communication style. Do you speak fast? Are you soft spoken that others ask you to repeat yourself or comment that you speak quietly? Do you shake your head when you speak to others to indicate yes, no, or I understand? Do you fold your arms when someone is speaking to you? Do you have an expressive demeanor or strong facial expressions when you are unhappy or annoyed? All of these have been known to cause miscommunication or a negative perception of someone's ability to communicate effectively or positively with others. So, what do you do if you fall into any of these groups? Speak clearly. Enunciate your words so that you are understood, even if you have a slight accent. Know that there are many different accents, colloquialisms, and slang here as well. So if you do not understand what is said to you, be sure to ask the person to repeat what was said just to make sure there is no misunderstanding. Pay attention to your body language. If you shake your head when you are being spoken to, this can confuse whomever you are speaking with, as they may not know if you are indicating yes or no. So do verbalize your understanding by saying, yes, I understand, or simply restate what you heard and clarify with the person speaking to you. Be mindful of how you present to others. If you realize that you have strong facial expressions that might cause others to think that you are unhappy or annoyed, and work on this often unconscious behavior. If there is ever a misunderstanding that you are trying to resolve, communicate calmly and politely. Be careful not to come across as argumentative. Remember, folded arms can indicate to the person you are speaking with that you are closed off from the conversation or do not want to listen to what is being said. So have a relaxed and comfortable posture. And finally, smile, as appropriate, of course. A pleasant demeanor and presentation style conveys that you are easy to work with and be around, and you are a professional nurse ready to do his or her best with your patients. Let us now look at receiving feedback from your preceptor or manager. Feedback is necessary for you to know how you are progressing through the orientation and during the assignment, to give you the opportunity to make any improvements where needed or to know whether you are doing well. If the feedback indicates that there is need for improvement in an area, how you receive the feedback is important as it indicates your openness to improving and willingness to learn from others as you adapt to practice on your new unit. Again, here are some questions for you to think about. 1. Do you argue when you are told about an error that you've made or if someone makes a complaint about your work? Do you refuse advice on how to perform a task according to the policy, saying that you already know how to do it? Do you sit back and refuse to comment if your manager is reviewing a need for improvement with you at work? While constructive feedback may be difficult to hear and can even cause you to question your level of confidence and proficiency, remember two things. 1. This feedback is necessary to help you to practice according to the policy of the hospital and provide safe care. And two, you are an experienced nurse in your home country, but not yet so experienced in US practice and culture, and this is what you are in the orientation to learn. So express thanks for positive feedback and accept constructive feedback gracefully without an appearance of defensiveness. Ask follow up questions to be sure you understand what you need to do to improve and follow through with any recommended work. Still express thanks for the information and provide assurance that you will work on whatever the improvement area is. Taking initiative and being proactive. These two behaviors generally mean that you actively seek learning opportunities, that you readily ask questions and try new skills with supervision, and ask for feedback so that you are sure that the new skill is being done well. Here are your questions to consider. Do you become apprehensive in new situations and worry that you might make a mistake, so you remain quiet and wait for the person training you to tell you what you should do? Do you prefer to wait and watch what others are doing, then just try to follow along? These are common mistakes for nurses new to the US, where they may take a step back during the orientation and wait to be told what to do while taking care of patients. This is exactly what you should not do. What you should do is ask questions about things that are unfamiliar to you. You should let the preceptor know when something is different where you came from, and you want to know how it is done here. Ask to try a task while the preceptor supervises you, and then ask them for feedback once you are done. If you have certain tasks on your orientation checklist to accomplish, like patient admissions and discharges, ask the preceptor or charge nurse how you can get these experiences. Talk to your unit educator on where you can get additional resources on the unit or additional training. And call your OGP clinical manager for help for additional educational resources if needed. You can go to your HealthStream education website and look for courses on unfamiliar conditions or skills that you encountered at work. Even YouTube can be a source of learning through educational videos on different skills like using IV pumps, how to insert IV cannulas, and other tasks. Not only do you appear eager to learn and do well, but you will create a strong first impression of yourself as a professional that your manager and colleagues would be happy to help and work with for a long time. Now we come to time management. Good time management is a critical need here in the US as patient care units are extremely busy with multiple patients and even relatives to care for and interact with, very complex patients with multiple comorbidities and specialized treatments, and documentation requirements that are more demanding than in many other countries. As a result, you will learn that there is need to be quick and efficient with patient care tasks. Using time management strategies like bundling or clustering tasks and care activities together when you go into a patient's room instead of going back and forth to do individual tasks. You will need to work with a sense of urgency in caring for multiple patients, often needing interventions around the same time. So you will need to be brisk with care, minimizing excessive time spent chatting in one patient's room or doing low priority or non nursing tasks that could be delegated to your nursing assistant. All of these are time management skills that will help you to be on time with your patient care activities. Apart from these, do ask your preceptor to give you tips to manage your time as well. Dealing with challenges. How do you manage challenges with other nurses, doctors, nursing assistants, even difficult patients and relatives? How do you manage when you have an overwhelming workload? As with any job, challenges will confront you. However, work hard to maintain the following principles as you manage challenging situations and individuals. 1. Listen carefully to what is being said and respond calmly and professionally in any situation, whether it is with an unhappy patient or a colleague. Remember that your charge nurse and manager are your on the spot resources and can be spoken with in the event of adverse situations involving patients and relatives or even colleagues. In the US, managers are very open to their nurses seeking them out for help and advice on how to manage well. And if they do not know what challenges you are facing, they will not be able to offer immediate assistance. So do feel free to seek out your unit leaders as needed. One common challenge that nurses from other countries encounter is feeling sleepy during the night shift. In the US, sleeping while on the hospital premises during the night shift is not allowed. You will be entitled to take your 30-minute break during your night shift when you find the opportunity to do so. However, you are not allowed to sleep on the premises as you may be called to care for your patients in an urgent situation. This is a serious policy issue that is essential for you to remember. Therefore, if you are to work the night shift, be sure that you obtain adequate rest prior to reporting for duty. And finally, HIPAA, the Health Insurance Portability and Accountability Act. This law mandates in part that healthcare personnel must ensure the safety and security of patients' healthcare information. For you, this means that you are not to leave a computer or physical file open and unattended with a patient's information visible to anyone passing by. You should not disclose a patient's information to anyone, whether in person or on the phone, without the patient's expressed consent. What does good customer service mean to you? In the US healthcare system, good customer service means that patients and relatives are treated with respect, they are provided with prompt and friendly care, and they are provided with information to educate and answer their questions. Patients and families deserve to feel like their nurse cares about their health, and this attitude of caring shows in how you interact and provide care for them. Apart from this, know that insurance companies can withhold part of the hospital reimbursements when patients perceive that the customer service they received from the staff is poor. Much of providing good customer service comes from the communication ideals that we discussed in the previous slide. This means that as you communicate with patients, you should introduce yourself pleasantly and clearly at all times, being mindful that if you have an unfamiliar accent, that you may need to slow down and enunciate your words carefully. You should be mindful of your body language and facial expressions. Do you convey warmth and caring? Do you make eye contact to give the impression that you are being sincere? Remember, such mannerisms as crossing the arms while speaking to others, not making eye contact, and shaking the head while speaking, depending on your culture, may not be interpreted positively, or it may confuse a patient or anyone that you are speaking to and cause miscommunication. So do maintain a pleasant demeanor, communicate clearly, enunciate well, engage your patients and colleagues in communication and in questions as appropriate. Be respectful even in difficult conversations with others. Ask your patients as you begin your initial rounding, what is the most important thing that I can do for you today? This shows you're caring from the start and sets you up for a great nurse to patient relationship. Let us review some internal challenges that you might encounter. After completing orientation, you will hopefully emerge with a clear understanding of what the expectations for your unit are, and although there may still be infrequent tasks that you may not have encountered during the orientation, you can certainly ask your charge nurse or colleagues for assistance. This is all part of functioning well within a team. Some nurses, however, may feel anxious or sad, feeling like the work is very different from what their previous practice was like and not at all what was expected. The nurse may feel that things would be easier if they could just leave and go home. Feeling like this within the first 6 months is absolutely normal. It is indeed part of the process of separating from your previous work life and learning to adapt and function in a new and different environment with different people and culture. This is a normal part of your transition and it is temporary. Remember, you are learning many different things within a fairly short period of time. But once you understand what is expected of you in terms of patient care and the processes of your new workplace, you work hard to integrate them into your practice daily, and soon they become your new normal, and feelings of discomfort will gradually ease. Keeping an open mind to learning and adapting and approaching each new situation with a positive attitude will serve you well in achieving your career goals in the US. Remember to always call your OGP clinical manager for advice and support. As an OGP clinician, you have many resources available to you. In addition to your unit educator, if there is one on your unit, you can always call or email your assigned OGP clinical manager for direction and support if you need resources to help in your transition or deal with any challenges. For educational resources, you can go to your HealthStream account and search for any of hundreds of clinical and professional courses. This is a free educational benefit that OGP has provided for its clinicians. You can also use your HealthStream account for continuing education hours needed to renew your nursing license as well. If you want videos for demonstrations on how to use various pieces of equipment like IV and PCA pumps, virtually any piece of equipment, go to YouTube. Other resources like ecglibrary.com can help reinforce your cardiac rhythm interpretation skills. Practicalclinicalskills.com is another great website as it teaches many other skills like learning different breath sounds, for example. Again, if you need help, speak to your unit educator or your OGP clinical manager if you are unable to find what you need. This concludes the OGP Clinical New Hire course, Clinical Orientation Essentials. You can access this course at any time on YouTube at your convenience. Remember, the OGP clinical team is here to support your transition to work in the US, and we are here to help you to provide excellent nursing care and customer service to your patients and families. We look forward to working with you. You can access this course on YouTube at any time. Remember, your OJP clinical team is here to support your transition to work in the United States, and we are here to help you to provide excellent nursing care and customer service to your patients and families. We look forward to working with you.